Here's my note cards. Okay. Imagine you knew that somebody was going to break into your home to rob you. Would you do something about it, or would you just simply let it go and allow yourself to become a victim? Probably not. Well, there is a danger out there that it could affect any one of us. It's the disease diabetes mellitus. I don't personally have the disease, but as a nurse I regularly assist others in helping them to manage this disease. And I hope that this discussion or this speech will better help you to understand the plight of a patient who has this disease, and also help you to identify the danger that all of us face in potentially acquiring this disease. Type 2 diabetes is a debilitating disease that could affect any one of us. Just consider, first of all, some of the things that make dealing with diabetes difficult. There are many different things associated with this disease that are debilitating. Things like poor circulation, renal insufficiency, vision loss and problems. But one of the most debilitating aspects of this disease is the need to constantly be monitoring blood glucose levels. See, glucose in the blood, if not monitored, if it were to go too high or too low, is extremely dangerous. This could cause kidney and various other organ failures, and ultimately would lead to coma and death. So it's critical for a diabetes patient to be vigilant in monitoring the level of glucose in their blood. How does a person monitor blood glucose levels? Well, primarily it's through the use of a device called a glucometer. There are many different types of glucometers, but usually they just look much like a regular household calculator. Along with a glucometer, the person would need a test strip, a sterilization device like a alcohol swab, a lancet of some kind, and would be recommended there to be gloves also. Now, a lancet is a simple device which is designed to, once the safety mechanism is removed, this is designed that this is applied to a person's skin, and when you depress this button, it allows a steel blade to shoot just past the end of the device and retract immediately, and would perforate one of the capillaries near the skin, allowing just a small drop of blood to be removed. Once the drop of blood is removed, the test strip is inserted into the glucometer, and the blood is wicked into the strip. The glucometer will print out a reading. That number will give you the level of glucose in your blood. A person can then use that number and apply it to a sliding scale that's been prescribed by a physician, indicating how much insulin should be injected according to the amount of glucose in the blood. Or if it's too low, it would indicate that a person needs to consume some form of carbohydrates to increase their blood glucose level. Now, because a diabetes patient has to monitor this frequently throughout the day, you can see how debilitating it can be for a diabetes patient, constantly to be drawing their blood, checking the glucose level, and injecting insulin as needed. Why, though, is it that all of us are in some form of danger of possibly acquiring the disease? Well, it has to do with the fact that diabetes type 2, which is the most common form of diabetes, according to one textbook, Understanding Med-Surg Nursing, 95% of all diabetes patients are type 2 diabetes. This is diabetes that is acquired later in a person's life. And it's due to the fact that cells within your body become no longer responsive to insulin due to many times obesity or excess consumption of carbohydrates. Now, a demographic survey performed by L-Tri-C students showed that 91% of those who partook of this survey consume carbohydrates, or a form of carbohydrates, whether cereal, bagels, pancakes, for breakfast, and that is their primary breakfast. It's common for Americans in our culture to consume large amounts of carbohydrates in our life, and therefore most of us are at danger if we're not careful at some point to develop this disease. What can we do to protect ourselves? Well, a real key is to have a balanced diet. According to one textbook, Introduction to Maternity and Pediatric Nursing, balance is the key to a healthy diet. And so a person needs to really balance the amount of carbohydrates appropriately within their diet. They also need to monitor their weight and have a good routine of exercise, because exercise also enhances the ability of insulin to remove glucose from the blood and help it to transport into the cells. So in conclusion, type 2 diabetes is a debilitating disease that can affect any one of us. As you can see, monitoring blood glucose levels is a critical way of helping a diabetes patient to cope with this disease, but it is also one of the most debilitating effects of this disease to have to constantly monitor the blood glucose levels. Also, you've seen that there are many methods that one can use to protect themselves from acquiring this disease, but the question is, will you protect yourself or will you become another patient?